Hi, my name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida, with a special interest in genital surgeries. And in this video, we're going to talk about buried penis, what is it, how to recognize it, and what the treatments for it are. And this, I will tell you, is a condition I'm seeing more frequently in folks, especially who have lost a large amount of weight, and you can have pubic redundancy or loose skin down there. And what happens typically in a buried penis is that because the attachments to the erectile tissue of the skin above are not there, what can happen is the penis can telescope back into all the loose skin and tissue that is there. Sometimes we see it in obese people, and in my practice more often now I'm seeing it in folks who've lost a large amount of weight, particularly with the new drugs such as Mounjaro and Ozempic. So these folks come to me typically with problems such as painful erections, repeated skin irritation, and infections such as balanitis in the head of the penis itself, because with time, when the penis is retracted in and telescoped in that tissue, hygiene can be very difficult. There can be a dampness there, and long-time irritation can occur. And very rarely, if this goes on for years, it can even be associated with penile cancers. So typically when I see a patient, oftentimes this problem, it takes a while to diagnose, and a lot of folks aren't aware that this is a problem that has a treatment. And so oftentimes when I see a patient with this problem, they'll come to my office and it's something they have been dealing with for a long time. And typically it's one of the reasons that has prompted them to lose weight, only to find that they still have the problem with the loose tissue that's there. So what can be done? So a lot of patients, first of all, when they come to me, will come to the office and pull up the tissue in the pubic area and say, if I could just get rid of this, it would look so much better and it would function so much better. And they're partially right, because that is a lot of the time what we do. One of the mainstays of treatment for this is we'll use typically liposuction and removal of the extra skin in the pubic area, and that gets you a lot of the way there. In many patients, another step that's really important is fixating the skin, the penis skin, to the underlying erectile tissue to make sure it doesn't telescope back in again. And so typically we'll do this with stitches above at what we call the penopubic junction, to make sure the skin stays where it is supposed to be and we don't get this telescoping effect again. And then typically in most patients we'll do it underneath. Some patients have a penoscrotal web, which we may get rid of at the same time as well, in order to better define the penis and make sure it can't retract back in again. So this is a life-changing life-changing surgery for a lot of patients, and many men don't even know that this is an option. So typically what it looks like with regards to downtime, well, the surgery itself usually takes me about 2 hours, give or take, and we can combine it with a tummy tuck as well. We'll oftentimes do that, especially in folks who've lost a large amount of weight. We can also combine it with liposuction of the love handles. It's a very common thing as well, to get a more sculpted masculine silhouette, or sometimes we'll just be focusing on this area itself. And so typically about 2 hours under anesthetic. I never use drains in my practice, so we won't have them. Everything, all the stitches will be dissolvable, and typically most folks will take 1 to 2 weeks off work, depending on what sort of work they do. And typically it's going to be about 6 weeks off strenuous activities such as the gym or sexual intercourse, about 6 weeks as well. And of all the things I do in my practice, the results tend to be very good with this. Sometimes, and it's rare, we may have to replace some of the skin on the penis. Like for example, if there has been years of inflammation and irritation and infection because of the fact that the penis was buried, we may have to get rid of some of that old scar tissue, or there may not be enough tissue there in the first place. Typically, we can take in tissue because usually folks, especially folks who have lost a lot of weight, there's spare tissue, an abundance of spare tissue there, and oftentimes sometimes we can kind of what we call flap it in particularly from around the scrotum in order to cover this, or rarely we'll do a skin graft, but that would be pretty unusual in most cases. So typically it's a fairly straightforward procedure. Sometimes it can be covered through insurance. We usually try to get a prior authorization if possible, and it tends to have really high satisfaction rates.